अस्सलाम वालेकुम या कनावदू या कनस्ताइन वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज मैं सर्जरी 22 नवंबर आफ्टरनून का पेपर करने जा रहा हूँ। सो लेट्स स्टार्ट। क्वेश्चन 1, द पेशेंट आफ्टर फॉल ऑन द आउटस्ट्रेट हैंड विद द ट्रॉमा ऑन द रिस्ट develops dislocation of the lower portion of the joint posteriorly and the medially. Most probably he has the Colles fracture. The contraction of the valve will be seen on the JVP waveform as the C wave. The patient after history of the stroke develops brain necrosis and ischemia. Which type of the necrosis will be seen? The liquefactive necrosis. The question 4, after a 25 years old male with the complaint of shortness of breath, X-ray shows the large shadow in the chest and echo on it was related to the right ventricle of the heart containing hemorrhagic and the necrotic areas, that is angiosarcoma. This question is bit missing. Question number 6, the patient with the hypertension died and an autopsy an enlarged heart was found. The cause is the hypertrophy. Question number 7, the patient has the depressed nasal bridge and the non-causating granuloma, that is leprosy. Next, which hormone is secreted in the response to fatty food and the cause late gastric emptying, that is CCK. The patient has the episodic hypertension. The catecholamines, the tumors due to which cells involvement, that is the chromaffin cells. Next, difficult to do venesection in the cubital fossa from median basilic vein. Question number 11, the old age patient having recurrent UTI PSA 3.5 from the DRE enlarged from prostate. This is likely the prostatic adenocarcinoma. The patient has the adrenal gland mass in the catecholamines increased level. This is likely the benign medullary CA. The patient after eating from the restaurant in the dinner, then at the midnight present the abdominal pain, vomiting and the diarrhea due to which of the following organism, that is Staph aureus. The person had molar tooth extraction, developed mandibular swelling with yellow discharge grape like the cluster colonies. The organism is the Staph aureus. The patient with the high BP 180 by 110 Na positive complement level normal. What will be other findings? That is the nodular glomerulonephritis. Next, question number 60, the patient undergoes the renal transplant. He is on the immunosuppressive therapy and develops angular cheilitis and the GIT problems. Causative agent is the Candida esophagitis. The female presented with the weakness on the right side. The CT scan shows the posterior frontal parietal and the medial temporal lobe affected. Which artery is involved? That is middle cerebral artery. The pituitary gland is supplied by the internal carotid artery. 19, ECF osmolarity is regulated by the aldosterone. The patient got a trauma catecholamine release in the 16 hours result in the vasoconstriction. Question 21, the patient presented with a sore throat and the whitish membrane covering the throat, that is definitely diphtheria. 22, 57-year-old man walking and the smoker for a long time having non-productive cough, which worsened for the past 2 months. Bilateral wheeze and the having 5 centimeter mass in the hilar region. Cause would be the smoking. The gluteal cramp due to the atherosclerosis of the internal iliac artery. The bone beyond law of ossification is the lower end of the fibula. The sternal angle at which vertebral level, that is the disc between T45. The submandibular gland is divided into deep and the superficial part by which of the following muscle? Myelohide. The relatation of which of the following structure causes dysphagia? By compression on the esophagus, that is alpha, which is the left atrium. Next, question number 28, the stab injury at the safe costal cartilage on the right side of the sternum will bias which of the following structure? The right atrium. The carbonic anhydrase is present in the cytoplasm of RBC. The thyroid hormone receptor present in which of the following inside the nucleus? Injury to the medial epicondyle results in the injury of the ulnar nerve. Next, 33-year-old young gentleman present the orthopedic OPT with the injury to the shoulder region in a fall from the 4 feet height. On X-ray, the joint is perfectly fine, but examination the patient cannot abduct his arm initially till 30 degree and after 30 degree passive movement by the surgeon. The patient is able to move his arm over the head. The likely muscle damaged would be the supraspinatus. The ventricle maximally filled at the end of the atrial systole. 34, the patient presented the weakness of the sternocleidomastoid and trapezius, unable to close his eyes and shrug his shoulder with the weakened palate elevation and absent gag reflex and harshness of eyes. The lesion is located at the jugular foramen. Which of the following is an autosomal dominant disorder with the tumor mutation? That is the familial adenomatous polyposis. Next, 36, the 9-month-old girl was vaccinated 2 weeks back, now presented with the rash all over the body, ecchymosis, fever, and the CBC report showing HB of 13.5, TLC count 6, and the decreased platelets 45. Peripheral smear shows the large platelet. What is the diagnosis? That is ITP. After surgery, what will occur in the wound of the clean suture? That is the scar formation. To know the origin of the neoplastic tissue, which test is used? Immunohistochemistry. To regarding the smooth muscle, that is don't fatigue. Grading of the carcinoma shows the degree of differentiation. Next 41, the Christmas disease will have increase in the APTT. The patient is having bleeding problem. Lab shows PT 14 second, APTT 60, bleeding time 6 minutes, and defect in which of the following pathway, that is intrinsic pathway. The patient presented the bilateral ptosis with the muscle wasting. On the mastication there is acetylcholine receptor defect. Suitable pathway. Pathology is the myasthenia gravis. The patient presented with the pneumonia, treated with the beta lactamase, remains hospitalized for the 3 days. Symptoms resolved but the developed diarrhea. Treatment for the diarrhea should be the metronidazole. Next, 50 years old female, diabetic, for the 20 years abdominal distension after meals due to the diabetic gastroparesis. The following is the most suitable drug for the treatment. There is a metoclopramide. The female patient of the village has developed gum bleeding after delivery. PT 14, APTT 60, neutrophil 2400. Burst cells are seen. The peripheral male FTP raised. Diagnosis is likely DIC. The pregnant lady with the labor pain and the obstructive labor was taken to the hospital but died before reaching the hospital. Most likely cause would be the amniotic fluid embolism. Regarding the bronchial asthma, the most probable findings would be FEV into FVC ratio less than 70. The patient has the anemia and the hypersigma neutrophils with the deficiency of the folate. Next, the patient undergoes gastrectomy, develops the macrocytic anemia. Treatment should be injection of the vitamin B12. Next, 51, the patient with the retrostrand chest pain and then died even after aggressive management. Likely cause would be the cardiogenic shock. Patient presented with the subcutaneous bleeding, bradycardia, and ecchymosis with the coagulation profile CBC. Normal diagnosis is the vasculitis. The patient had an MI on the ECG, ST elevation 2-3 AVF. The vessel involved would be RCA. Next, 54, which is used in the coronary bypass, that is saphenous vein. The child having the tumor with the blue cells, which is secreting catecholamines and is because of the amplification. What is the most probable diagnosis? That is the neuroblastoma. 50-year-old man presented with HPF 8.2, enlarged spleen, TLC raised. Peripheral smear showing the immature myeloid lineage. What is the genetic defect? 9:22. Brain tumor most commonly occur after radiation is the meningioma. The virulence of the Staph aureus strain is measured by the protein A. Next, 59, the female 17-year-old with the primary amenorrhea, absent secondary sexual characteristic in examination, well developed normal breast and the blind vagina. Ultrasound confirm absent of the uterus. Most likely the karyotype of this would be the testicle feminization. Climber at the high altitude experience hypothermia on the returning to the base camp, adapts to the cold weather by heat generation due to the which of the following? There is posterior hypothalamus. Which one located anterior to the masseter, that is the facial artery. The medullary CA proto-oncogene is the RET. Next, 63, the true about the parotid duct is the pars buccinator muscle. Drug of choice for the meningitis in the old age is the septal axon. The least dilatable part of the urethra would be the membranous part. At puberty, the testosterone function in the thickening of the laryngeal cartilage and deepening of the voice. Alzheimer's disease associated with which of the following? The Down syndrome, thrombocytopenia is the side effect of the quinine. The patient unable to recognize faces. The area injured would be the parieto-occipital temporal lobe. 70, the microbiologists were examining a slide under the microscope. It showed the cell shrinkage, condensed nuclei in the cells, irregular cell membrane of the cell. What is happening to the tissue? That is apoptosis. The GI to next phase required the DNA. Posterior wall gastric ulcer pain carried by the greatest blanketing nerve. Right atrium infarction valve. Which of the following? That is the pectinate muscle. The part of the pituitary gland at the infundibulum is called the pars tuberalis. Next, the terminal bronchiole does not have the cartilage. This feature differentiates it from the conducting airways. A 10-year-old boy diagnosed with the tapeworm infestation, the drug of choice would be the niclosamide. Jugular-digastric lymph node of the deep cervical lymph node drain into the palatine tonsil. The organisms which produce the fluorescent pigment resistant to beta-lactam, that is the pseudomonas, the loud S1, opening snack, and mid-diastolic murmur. Mid-diastolic murmur at the apex, that is mitral stenosis. Next, sickle cell disease abnormal RBC removed by the spleen and the sinusoidal capillaries. Which of the following lymphoid structure does not contain the lymph nodules? Thymus, recurrent reaction, fever with the blood transfusion, best to do leukocyte filter. Neutropenic hypertensive patient admitted the oncology ward with a history of the dysuria and high grade fever. His blood culture yielded growth of the Pseudomonas aeruginosa. These findings suggest that the disease is a result of excessive release of the following product, the TNF. The interleukin secreted by the T cell causing the RBC growth would be the interleukin 3. Next, the patient came with the left hypochondrium pain on the palpation, splenomegaly was found. How will you confirm the hypersplenism? That is beta, which is bone marrow aspiration. The female present the HP of 9.6 and doctor prescribed iron. After 2 months, she presented with the HP 10.2. What should be further considered for the diagnosis? The HB electrophoresis, most common midline abnormality, the median cleft lip, nucleus of the muscle, elevating jaw would be the trigeminal motor nucleus, pure orange appearance of the breast occur in the malignancy of the breast due to the venous plus venous obstruction. Next, the young female taking analgesics for backache presented with the gum bleeding epistaxis. She has the fever of 101, the mild jaundice, and the hepatosplenomegaly, HB9, TLC 7000, neutropenia, thrombocytopenia on smear immature cells. Diagnosis is the drug-induced anemia. An obese patient wears a tight collar shirt and the feels tightness in the collar and the faint whenever he turns his head. Which of the following is responsible for this increased venous compliance? Squamous cell carcinoma, a common site is beta carina, hypoxia induced vasoconstriction in the lungs. The lung compared to the systemic circulation has the decreased resistance. Plantar arch is the branch from the dorsalis pedis. Next, an old patient presented with a short leg which is laterally rotated. Which fracture is suspected? That is the neck of femur, ureter damage while ligating ovarian artery at the pelvic brim. The 8-week pregnancy with affected disorder drug given should be the escitalopram. The structure having the columnar epithelium with the clefts in it and the smooth muzzle. This is the fallopian tube. Renal tubular cell basolateral membrane has the sodium potassium ATPase pump. Mechanism of action of the acetazolamide is the decrease hydrogen secretion and increase in the sodium potassium activity. 1 or 2, the iodine eliminated from the body via urine. The thoracic duct drain into junction between the left internal jugular vein and the left subclavian vein. The hypospadias is due to abnormality of the urogenital folds. 1.5, the submandibular gland lies at the mandible angle. Surgery of this will lead to the damage of which structure adjacent to this, that is the facial. Next, 106, the short-term control of the BP is done by the baroreceptors. The playing child got ankle sprain, result in the damage to the lateral malleus. The phrenic nerve accompany which of the following? The pericardiophrenik artery. The patient has artery, he does not know recent events but he remembers his school events. Where is the lium? That is the hippocampus. Histamine, most important mediator inflammation source of the histamine, that is the mast cell. The congenital erythropoietic porphyria, what is the finding in the urine? The increased urine uroporphyrin. The minimal change disease feature is the proteinuria 3.5 gram/day. 113, the female presented with the dysphagia to liquid for the last 6 months. Laryngoscopy shows the normal histology of tract. The most likely cause would be the loss of neuromuscular coordination. The tumor suppressor gene involved in the renal and the gonadal agenesis would be the WT1. The antiseptic for the skin, surgical gowns, that is the chlorhexidine. The coronary blood flow is mainly maintained by the myocardial oxygen demand and the consumption. 117, the Klar hand produced by the unopposed action of the extensor theorem and the flexor theorem superficialis. Hyperkalemia associated with Charlie, the flaccid pelvis, the origin of the diaphragm is the cervical somites. The primordial germ cells are formed at the end of the 3rd week. Benign tumor among the given is the Wathen tumor. The GIT, 3 layers of muscles on the histology of the fundus of the stomach. The child presented with abdominal pain with the dysentery. Stool contains the pus and the abscess. Causative agent is the enterohemorrhagic acecoli. The 25-year-old girl presented the lower abdominal pain. She is suspected of having abdominal pelvic mass of umbilicus. The chest mass is also found which tumor marker is likely raised, that is CA125. The young boy eat food from the restaurant and after a few days develop jaundice and loss of appetite. The cause would be the hepatitis A. Edema in the CLD cirrhosis patient. Cause is the decreased plasma colloid osmotic pressure. Next, 127, the antibodies in the Hashimoto's thyroiditis, antithyroglobulin and the antimicrosomal. The patient taking omeprazole for the GA disturbance, having joint space narrowing, interphalangeal and the distal phalangeal swelling. Treatment should be that is alpha simple paracetamol or acetaminophen 1000 mg TDS. Next, 129, the 27 old woman presented with the complaints of the weight gain, menorrhea and the fatigue. Last year she experienced a complicated delivery requiring 2 units of the blood transfusion. She was unable to breast fat examination. She has a dry skin and hypertension. Which of the following is the most likely diagnosis? That is Sheehan syndrome. The patient came in the OPD with the recurrent calcium stones. What will you give for the treatment? That is the thiazide diuretics. The 16-year-old with a 15-year history of the diabetes. How to check long-term glycemic control, the glycosylated hemoglobin, the EDH blood will accumulate between dura calvaria. Osteoblastic activity marker is the ALP, which of the following cause the complement fixation in the classical pathway, that is Charlie IgG3. Next, 135, the patient has the fever and the abscess formation. Which of the following is the pan meditated abscess region? That is the prostaglandin. Man working in the ship industry is at the risk of developing the bronchogenic carcinoma. Skin cancer most commonly associated with the AIDS is the Kaposi sarcoma. The surface surfactant decrease surface tension by the breaking interaction between the water molecules. The second order neurons of the anterior spinothalamic tract lies in the substantia gelatinosa. Next, 140, the child while supine with the peanut aspiration will lodge in the right lower lobe. Regarding sensitivity, true is the percentage of the diseased and positive. Next, 142, a man during a roadside accident suffer injury to cervical sympathetic chain, most likely change in eye, that is ipsilateral pupil constriction. The patient has fever and draining sinuses. Sulfur granules containing organism is the actinomyces. 144, which of the following is released at the synapse between the incoming pain fibers and the pain inhibitory fibers in the spinal cord, that is enkephalin. 145, the left optic tract lesion cause VN loss of which of the following, that is the left nasal and the right temporal. The patient has a history of the recurrent bleeding and the hemolytic anemias. Most likely pathology is the ascorbic acid deficiency in a normal person. Which muscle involved in the forced expiration, that is the rectus abdominis. The child has the papules rash starting from behind ear and the spreading to the whole body. Most likely the diagnosis is the measles. The standard deviation is the square root of the variance. Newborn child having the ossification center at which of the following, the distal end of the femur. Least minerals found in the tubers. The primary active transport uses beta, the hydrogen potassium ATPase in the parietal cells. 153, the patient in RT has the fracture of the neck of the fibula, presented the inability to eversion and the dorsiflexion of the foot. The damage has occurred to which of the following nerve, that is a common peroneal nerve. The patient of asthma having ABG-pH 7.23, bicarb 226 and hypercapnia, likely acid-base disorder is the respiratory acidosis. The patient 25% nephron is working. What will happen in the remaining nephron? Increase GFR in the remaining nephron. The auto-regulation of the GFR is by the tuboglomerular mechanisms. 157, the patient has the long-term memory loss due to the damage of the bilateral hippocampus. Final processing of the carbohydrate in the glycoprotein occurs in the Golgi bodies. The patient after stroke develops obesity. It is caused by the lesion of which part of the hypothalamus, that is alpha ventromedial nucleus. 160, the nerve causing gustatory lacrimation while eating is the facial, while ropivacaine preferred over bupivacaine because it's less toxic. The stimulation of the beta adrenergic causes the cardiac acceleration. The patient has increased hepatic glycogen with the normal structure of the liver. No increase in the serum glucose occurs after giving fructose. Which enzyme will be deficient? That is beta glucose 6 phosphatase. Next, 164, the pH 7.3, bicarb 15, perspiration of carbon dioxide 38. The diagnosis is the mixed acidosis. The clavipectoral fascia is pierced by the cephalic vein. The pericardial senses location for the straw colored fluid is which of the following? There is the caudal sternum region at the medial end of the fourth and fifth costal cartilage. The 8-year-old boy used to eat mud, vomited and had respiratory symptoms. Passed a 6-inch long worm through his nose. The organism is Ascaris. 168, the tailor had the TB infection transmitted to 2 of his family members. Mode of the spread would be the aerosolized air droplets. The patient has the RBC cast and white blood cell in the urine due to the damage of the glomeruli. Which the following is detected by the peripheral chemoreceptors? Decreased pressure of oxygen. Site for the pleural tap is the lower border of 9th intercostal space of the mid axillary line. 172, patient has the liver cirrhosis. Route of the hepatic biopsy is the T10 mid axillary line. Which the following finding will be found in the person having bradycardia and the hypertension, that is raised ICP. 174, the long gastroerythrocytic stage is of the Plasmodium malariae. The medial arch of the foot is supported by the calcaneonavicular. During transport of carbon dioxide in the blood, the amount of the carbon dioxide dissolved in the plasma at the 45 mm of Hg is falling, that is 2.7%. The structure most likely passed by the needle during the lumbar puncture is the ligamentum flavum. The structure most likely passed by the needle during the lumbar puncture is ligamentum flavum. The surgeon doing open heart surgery producing from the vein anteriorly with the anterior interventricular artery is the great cardiac vein. The surgeon doing the open heart surgery, that is same MCQ again. The muscles have the different classifications according to their actions and the features. They are divided in the different groups and subgroups according to one classification. The following muscle is the white muscle, that is the gastrocnemius. Next, 26-year-old male presented to you in the surgical ER after penetrating injury to the right lateral chest. On the examination, when he inspired, the mediastinum moves to the left side. During expiration, the shift towards the left side is enhanced. Where will be the most likely diagnosis? That is tension pneumothorax. Next, 183, which of the following muscle cause the hip and the knee flexion, that is sartorius. Before deciding for the transplant, the measure of the renal function is done by the creatinine clearance. The 50-year-old patient post-operatively developed the DVT. The most common cause for the formation of the DVT is the prolonged immobilization. The female patient presented the pain. Hypochondrium expiratory laparotomy was done, which showed that ovaries were attached to the lateral pelvic wall, which structure in this area has increased risk of damage during the procedure. Internal iliac artery, the post-synaptic inhibition means the post-synaptic hyperpolarization. There is no edema due to the increased aldosterone because of escape mechanism. The increased ESR is due to decreased albumin. Drug that is inactivated highly in the liver is the nitroglycerin. The diagnosis test for the pheochromocytoma is the VMA in urine. So that's all from this particular paper. Thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.